Hi everyone, welcome to Crownedge. I'm Dr. Janani and today we are going to cover this topic of child psychology. So child psychology is a very vast topic and I have covered this topic under various subheadings and I will be dealing certain MCQs under the subheadings. I want you all to have a standard pediatric textbook with you so that you can cover this topic along with me and complete this topic today itself. So do not postpone. It's a very fact-based and theory-based questions that you will be having and it's very simple to answer. So have a pedo textbook with you with when I cover this topic so that it's easy for you to cover it today itself. Okay. So let's move on to the subheadings that I will be covering on. So this topic I will be covering on 4 major subheadings. First will be an emotional development. Okay, so you would have seen a lot of questions in your final year BDS as types of cry, types of fears, fear assessment scales, anxiety, all those things which can be asked as a direct question. So that I will be covering under emotional development. So we'll discuss what is an emotion, how is an emotional develop, at what age it develops, what are the types of fears, what are the types of cries, anxiety, worry, fear assessment scales, all these things we will cover under that first topic. Second is the theories of psychology. Very direct, very fact-based questions can be asked. Very simple. In that topic, I want you all to remember few things when it comes to theories. Who gave which theory under what content? There are certain subheadings for theories, right? Under what content it comes and what are the alternative names of those theories and certain concepts of that theory. You don't have to go into way too depth of all the theories, but understand the basic concept. So as and when I cover the theories of the child psychology, I'll give you the basic concept of it. Understand, just go through the textbook simultaneously so that you understand the concepts of these theories very well. It's very simple. It might look very major or very difficult for you to understand, but they're very simple concepts. So direct questions can be attempted from this topic very easily. It's just going to save a lot of time if questions are going to come from this topic. Okay, but all I want is you to be really thorough with the person who is given the theory, the year at which they have given, the basic concepts and the alternate names of the theory. Okay, so there are principles of certain things. All these things we'll keep covering as and when the questions are coming. All right. Third is the behavior management. So we have non-pharmacological management and the pharmacological way of managing child in the dental setup. So let's cover both the topics. It's very simple. You all know all these things really well. Certain things you need to be very thorough on. So those things we will cover. All right. And fourth is a pharmacological means of management, like under conscious sedation and general anesthesia. What are the medications that are used? What are the things that you need to be really aware of when giving this pharmacological management of means of management. Okay. So with this, please have your textbook beside you. Let us cover topic by topic and let us complete this chapter today itself. All right. So let's move on to our first question for today. First is development of emotion depends upon option A, endocrine output. Option B, maturation of nervous development. Option C, both A and B. Option D, none of the above. So what is an emotion? Okay. Emotion is nothing but a mental state of excitement. Okay. Okay, so this depends upon the psychological aspect of an individual, the behavioral changes of an individual, and the feelings of an individual. So what do you think an emotion is? Any emotion that can be, it can be either happiness or it can be sad, it can be grief, it can be anxiety, it can be fear, anything, all these worry, distress, all these things are part of emotion. Now, why is this important in our pediatric dentistry? Is because when a child comes to us, all these emotions are a part of a treatment. Okay, it's just not we treat the child and leave them, but all these emotions play a major role in a part of our treatment. That's why this chapter comes into our consideration. So when it comes to this question, development of emotion depends upon, we're given 4 options here. Okay, for a person, it depends upon the endocrine output and the cortical maturity. Okay. So these two are the main reason for an emotion to be developed. Okay. So the difference between a child and an adult, an emotion that is being portrayed by a child is different from that of an emotion that is portrayed by an adult in a dental chair. Why is it different? It is because of the cortical immaturity in the child. Okay. It is not very much matured in the child. and the endocrine output is different. So that is why a child shows a different emotion, that they are very scared, they start crying, they are very shy to come into the dental clinic. All these emotions are because of these two factors. Okay, so development of emotion mainly depends upon the endocrine output also and the maturation of nervous system, that is a cortical maturity. Okay, so right option to this question would be option C, option A and B. Okay, so keep in mind, emotion depends upon two factors: the endocrine output, the maturity of nervous system, that is a cortical maturity. Okay, that's why the child and an adult varies in emotion. Okay, adult will be more, he will not show out more fear, he will not be shy to come into the clinic, he will not cry in the dental clinic. So all these emotions are based on these two outputs. Okay, so let's move on to our next question. Siren-like wail is characterized under what type of cry? Option A, is it frightened cry? Option B, is it hurt cry? Option C, is it obstinate cry? Option D, is it compensatory cry? For which you need to know the types of cry. Okay, so let's see what are the types of cry. Okay, a person by name Elsbach, E-L-S-B-A-C-H, had given in this year 1963 the types of cry. So okay, he had classified it as obstinate cry, frightened cry, hurt cry and compensatory cry. You can remember it as OFHC. OF of HC. Okay, so obstinate cry will have siren-like wail. Okay, and they show temper tantrums. These are the characteristics. You need to remember this so that it's easy for you to answer, right? Temper tantrums and loud high-pitched noise. High pitch. Okay, they cry out loud. They have the siren-like wail tone and they show temper tantrums. Okay, so this is for obstinate. These are the three main characteristic feature of obstinate type of cry. Frightened cry. So frightened cry is more of torrent of tears with breath-catching sobs. Before they enter the chair, if they start crying, when they hear the aorta's noise, they start crying. This is all more of a frightened cry. Okay, hurt cry is again loud and high-pitched with small whimper. Okay, this is like when you give an anesthesia when they have pain, right? It starts like a tear drops from the corner of the eye and then a lot of tears start coming. It's more because of that they are under pain. So it's more of a loud and high pitched with small whimper. Compensatory cry is not a cry at all. Okay, it is more like slow and monotone. This is more for a coping. Okay, suppose if the child hears us drilling, the drilling noise or the handpiece noise is too loud, they start crying out, so that they cry out loud to compensate the noise of the handpiece. So that's called as compensatory cry. It's not exactly a cry. They have the slow and monotone voice, and it's more of a coping mechanism, so that they make sure that the voice is so loud so that they compensate the noise of the aorta. So that is more of a compensatory cry. So remember the types of cry, who gave it, what year they gave it, and the types of cry. Okay, each has one certain characteristics which is easy for you to answer. So with this note, let's go back to our question. So siren-like wail is characterized by what type of cry? Is it option A, frightened cry? No. Option B, hurt cry? No. Option C, obstinate cry? Yes, it's not a compensatory cry. So right option to this would be option C. So if you know the characteristic of each of this cry, it's very easy for you to answer. It's a very direct, easy question to answer it quickly also. So be thorough with this type of characteristics of each cry. Okay, let's move on to the next question. Loud, high-pitched cry with temper tantrums are seen under what type of cry? Is it option A, frightened cry? Is it option B, hurt cry? Is it option C, obstinate cry? Or option D, compensatory cry? Let's go back to this thing. So which has temper tantrums being shown and high-pitched noise is the obstinate cry. Okay, so right answer for this question again would be option C. It is obstinate cry. They can ask any of these characters like what I've given. It's not a cry at all. Slow monotone voice which cry is used for a coping mechanism, or which has a lot of breath catching sobs. Any of this characteristic can be asked as a question. So be thorough with the types of cry and each characteristic of all the types of cry. Alright. So moving on to the next question. Fear related emotions are option A, anxiety, option B, worry, option C, shyness, option D, all of the above. First, I want you to know what is fear. Fear is more on reaction to a known danger. Okay, you know what the danger is, and it's a reaction of the individual to a known danger. Okay, so fear related emotions can be option A, yes, anxiety, yes, option B, worry, also yes, option C, shyness, yes, and option D, all of the above is the right option. So all these three are a fear related emotions. So remember, anxiety, worry, shyness, all these three are fear related emotions. So option D is the right answer. Remember, fear is a reaction to a known danger. I will let you know why in the coming slides. Alright, remember this definition of fear. Okay, moving on to the next question. Reaction to unknown danger is option A, anxiety, option B, worry, option C, fear, option D, grief. Now I just told you reaction to a known danger is fear. So the question to us is reaction to unknown danger. So fear is ruled out here. Reaction to unknown danger is anxiety. Okay, you don't know what the danger is about, but you're anxious when you enter the clinic. You're just anxious on getting a dental treatment. You just don't know what is going to happen. So it's more on a reaction to an unknown danger. Fear is, you know, the external stimulus which has already been there. So you know what the danger is, and that's why you are scared of. So it's a reaction to a known danger. Whereas anxiety is a reaction to an unknown danger. So keep this in mind. Unknown danger is always anxiety. Known danger is always fear. Okay, keep this in mind. Okay, so let's move on to our next question. Fear is a primary emotion acquired soon after birth. Option B, primary emotion acquired in utero. Option C, primary emotion acquired 4 years post-birth. Option D, it's not a primary emotion at all. So what can it be? Fear is obviously a primary emotion. So option D is ruled out. So let us look into our other options. Option A, is it acquired soon after birth, or acquired in utero, or 4 years after birth? Fear is an emotion, primary emotion, that is acquired soon after birth. In soon after birth, a child, if an infant is subjected, you just take an infant, just born baby, they have something called a startled response. Okay, suddenly if they hear to a sudden noise or something, they get startled, right? They don't know the exact reason, they have not understood it, they are just an infant. But this startled response is a type of fear that they portray in an infant. Okay, so the first emotion that they is fear is one of the first emotion that they portray, and which is acquired soon after birth. It is not acquired in utero, not 4 years post birth. Okay, so fear is a primary emotion acquired soon after birth in the form of a startled response. Okay, so this is one question they can ask us in a 2-year-old child. Okay, in a 2-year-old child, what kind of fear is being portrayed? For a 2-year-old child, every age group, okay, like 0 to 2 years, 2 to 6 years, preschoolers, school-going children, and adolescents, classifying under this category, every age group has a different portrayal of fears. They have certain reasons of why they get fear. Okay, so in 0 to 2 years, it's more of startled response. It's being portrayed as a startled response. From 2 years of age to preschooler, okay, in that age, it's more of a separation anxiety. Why this comes into a question is, if a child of 2 years or 3 years old come to our dental clinic and they don't want to leave the parent, it's more of separation anxiety that they have. That is a fear that they portray on. Meaning, if someone else is holding them, if someone else is going to work on them or do a dental treatment on them, they get scared that they are being separated from the parents. So separation anxiety is a very classical feature of a 2-year-old, 2 to 6-year-old, not exactly 2 to 6-year-old, 2 to 4 years old, it is more predominant. All right. So every age group has a certain type of fear, which more of this very important ones are the startled response and the separation anxiety. All right. So let's move on to the next question. Fear from unpleasant contact with a dentist is characterized by what type of fear? Is it an innate fear? Option B, subjective fear. Option C, objective fear. Option D, imaginative fear. So for that question, let's look into the types of fear. Okay. So types of fear is more on general fears and dental fears. Okay. Okay. For us, the more important one is the dental fear. So dental fear is being classified as innate fears, objective fears, and subjective fears. Okay. Innate fears is more on individual basis. Okay. They don't have any external stimuli, any previous experience that is causing them. It's more on a vulnerability of an individual. It varies from person to person. From birth, if a person is scared of something, so we don't know the reason of it. Okay, so that is more on an individual basis, vulnerability of an individual. And that, okay, so it's more on the vulnerability of an individual. Okay, next is objective fear, very important one that you need to know. Objective and subjective, listen carefully, the difference between objective and subjective fear. Objective fear is more based on an external stimulus, like if the child sees or smells or anything, they come in direct or physical contact with the previous thing, that is kind of fear, okay, objective fear. Whereas subjective fear is more of a imaginative type of fear. So let us see the examples of an objective and a subjective fear. Objective fear is like when a child has already gone through a previous dental experience. So he's undergone it, or if he sees someone going through it, okay, or if he's got a fear in hospitals, like the smell of hospitals kind of make him scared of things. All those things are objective fears. So they have direct physical stimulation. Okay, when they see their sister undergoing a painful treatment, or the smell of dental cements, they've already undergone through it, and the smell of dental cements is direct stimulation for them. So all these things are of more of objective basis. So when they have direct stimulation that the child can see, smell, or all type of objective fear. Subjective fear is by an external influence. Okay, for example, if a mother is scared of a dental treatment and the mother portrays that fear to the child, it is more of a subjective fear. The child has not seen it. This child has not gone through it. The child hasn't gone through the dental clinic at all. But the mother has been portrayed, or the child sees a mother explaining someone how the painful treatment for her was. So all these are more of an imaginative type of fear. So that is more of a subjective fear. This subjective fear is deep-rooted and very difficult to overcome. All right. So remember this. Innate fear is more of an individual basis. That is very clear. This we know, innate, right? Objective and subjective, they can ask any type of questions. Okay. They can put a clinical scenario and they can ask what type of fear is it. Okay. Remember, objective is only by direct stimulation. When the child sees it, when the child undergoes it, or the child smells it, or any type of external stimulation is bothering the child, that's when objective type of fear comes. Subjective type of fear is more of an external influence, like the child's friends is saying him, or the mother is portraying him, or anything like mother is holding the child's hand during the dental treatment and she's showing a type of fear in her face. All these are subjective fears. Okay, the child is not going through anything, but the external stimulations, external influences are affecting the child to have a subjective fear. This subjective fear is very deep rooted and it is very difficult to overcome. Okay, these 3 points keep in mind and answer let's go back to the question and see what answers we can give from these questions. All right. Fear from an unpleasant contact with a dentist is characterized as innate fear, subjective fear, objective fear, or an imaginative fear. There is an unpleasant contact with a dentist. So there is direct stimulation, right? The child has gone to a previous dentist and he or she had an unpleasant contact. So this is more of, is it an innate fear? No, this is not an individual basis. It's not from birth. They have not told anything of that sort there. Is it a subjective fear? This is more of a direct stimulation. Has the child had is the question mentioned with any external influences here? No. right? They've not mentioned about the mother or the friend or anything, that external stimulation, external factors, nothing is being given here. Objective fear, yes, this is a classic example of an objective fear. The child has gone to a previous dentist and he has undergone an unpleasant experience, and that's why when he comes to the next visit, the new clinic, when they come to your clinic, they have this kind of fear that they portray. So objective fear is a right option. Option C is a right option. Imaginative fear is another name for subjective fear. Like I told you, it's more of a imaginative fear, right? So it's more of a subjective fear. Okay, so answer, just use your presence of mind, know these 3 points very clearly, what exactly comes in objective and subjective, and answer this question.